local hospital's failure to take them or their concerns seriously. Now, I'm going to tell their story, and as I do so, we'll pull up pictures so you can put faces to names. Gary Fowler was 56 years old when he died in April. Now, Mr. Fowler went to multiple hospitals trying to get a COVID test, and each hospital would turn him away. He experienced all the symptoms of COVID-19, so shortness of breath, fatigue, high fever, and all of the hospitals turned him away. He died on April 7th, and an autopsy showed that he did indeed have COVID-19. And we're looking at a picture of him with his father, David Fowler. And I want to talk a little bit about something that Mr. Fowler's son, Keith Gambrell, said to the Detroit Free Press when describing this experience. And I'm going to read this quote right now. He said, "My dad passed at home, and no one tried to help him. He asked for help, and they sent him away." Now, Gary Fowler's father, David Fowler, lived across the country in a predominantly Black neighborhood in Boston and had the same exact experience. Was experiencing COVID symptoms, went to multiple hospitals, tried to get treatment, tried to get tested, and he was turned away. He died just a few hours before his son, Gary Fowler, did. And then it just gets worse. His mother, so Keith Gambrell's mother, Gary Fowler's wife, Cheryl Fowler, experienced the same symptoms, went to the hospital, tried to get tested, treated, and they turned her away. And her son describes that experience to the Free Press, and he says, "Before they even looked at my mother, there was a young Caucasian lady complaining about sushi she got from Grubhub that upset her stomach, and they swooped her in the back like she had coronavirus," he said. "But my mom, she had all the symptoms, and they tell her just to go home. That makes no sense. They helped a girl who ate bad seafood over someone with all the signs of needing medical help. I feel like they sent my mother home to die." Now, Cheryl survived, but she spent 10 days on a ventilator after a hospital finally admitted her. Now, the Fowler's family story is just one example of how Black Americans have been disproportionately impacted by COVID-19. But the numbers really tell the rest of the story. So here's some numbers. Black Americans are 3.7 times more likely to be hospitalized by and 2.8 times more likely to die from COVID-19 than white Americans. Black Americans make up only 13% of the US population, but represent a third of people hospitalized with COVID-19. And 71% of people who are Black say they know someone who died or was hospitalized because of the virus, compared to 54% of Americans overall. Now, with a vaccine on the horizon, 42% of Black Americans say that they would take the vaccine, compared to 60% of the general public. And distrust in the Black community is substantially higher than distrust in white communities, for good reason. There is a long history of mistreatment, of abuse in the medical profession of the Black community. And it's something that has breeded a lot of distrust over the years. And fortunately, we have an expert here to talk to us about this issue, because I certainly am not an expert, and it is a long and extensive history. And we are very lucky to be joined today by Professor Michele Goodwin, Director of UC Irvine Center for Biotechnology and Global Health Policy. Professor, thank you so much for joining us today.
It's a pleasure to be with you. Thank you so much for hosting a really important conversation, not just for these times, but it's important to map these issues and their historical legacies in our nation.
Absolutely. So, Professor, and you've written extensively about this issue, and you've written extensively about the history of institutionalized racism within the medical profession, particularly when it comes to medical research. And so right. I understand that whole history could probably take 10 segments in itself. But I was hoping that you could sort of summarize that history for our viewers who might not be so familiar.
I'm happy to do that. So the history of medical experimentation, medical neglect, medical harms, medical exclusion affecting Black lives dates back to the antebellum period. It dates back to the times of enslavement, where Black people became the unwitting victims of medical experimentation. Black women, by Dr. Marion Sims, who was later hailed as the grandfather, godfather of modern gynecology, with statues put up in Central Park and across the country. And yet he did the most terroristic kinds of experimentations on the Black women that he rented and bought. He wrote in his autobiography how he would have epiphanies in the middle of the night and then go to them and literally cut open their bodies, cut into them with no aid of anesthesia. And he would write about this. And to give you some sense of what it means in a culture that's used to treating the Black body in this way, his autobiography was hailed. It wasn't until I read his autobiography more than 20 years ago that I wondered, why in the world were there medical professors across the country thinking that this was brilliant, when right in front of us we were reading about the torture that he conducted on Black women's bodies. But what we've also seen too is that as businesses have looked to develop in various areas, you've seen literally dozens, if not hundreds, of skeletons believed to have been associated with Black people, Black bodies in the basements of what used to be medical schools and hospitals in various parts of the South. It's very interesting that one of the key forces behind advertisements for medical schools in the late 1800s and 1900s was that the ability to be able to experiment on a cadaver. And whose cemeteries were targeted? Black cemeteries. In Pennsylvania, there were Black families that actually had to hire Knights Guards people in order to protect their loved ones' grave sites, because they were being pillaged by people who were looking to dig up cadavers so that they could take them on to medical schools. I could give you, again, we could do 10 shows on this, and we've not even gotten far beyond slavery. I mean, not to mention the transition then during Jim Crow, where Black people were excluded from and died on the front steps of hospitals that served white people that refused to admit them. And there's a long legacy of that in our country. And so whether we're talking about medical experimentation, medical exclusion, the American Medical Association very recently apologized to Black doctors and medical schools because they actively lobbied against the formation of Black medical schools and then refused to admit Black doctors into their society, claiming that the reason for doing so was that Black medical schools allowed women to train alongside men. And that only gets us a little way on this. It doesn't account for what you described and what's described in so much of my writings, or the writings of people like Dorothy Roberts, Harriet Washington in her book Medical Apartheid, where modern day experimentation, Holman's prison in Pennsylvania, experimentations on incarcerated Black people, literally cutting their skin off. I mean, things that were just like deplorable that you couldn't actually imagine. Medical experiments on children, lead studies, HIV studies, and so much more. And we've not even talked about the Tuskegee experiments, right? And so maybe I'll stop there so that you can get another question in. But for 40 years, even continuing after Nuremberg, the United States government and medical researchers at universities involved in a very deceptive study involving syphilis and poor Black farmers. The study was to figure out how syphilis affected the body. When the study first began, it was not understood what could be a treatment for syphilis, but very early on, it was discovered that penicillin could cure it. Now, what we know that syphilis can do is it can cause blindness, death, various impairments, and paralysis. It can be transferred onto one's offspring. That's called congenital syphilis. The United States government continued in this study watching Black people die in the most aggravated ways, watching Black children born with congenital syphilis and all of the horrible side effects, lying to these individuals, telling them that they were receiving a treatment when in fact they were only receiving sugar pills. Now, the reason why I mentioned Nuremberg is because after the horrible experiment conducted on individuals, mostly Jewish, but not exclusively in Nazi Germany, the United States went to Germany, said, this is horrible, you must not do that. There were hearings that specifically charged doctors with crimes. And yet in our own backyard in the United States, were experiments like this going on that lasted for decades after Germany's Nuremberg trials. So this is why, and it lays only part of the foundation in terms of Black people's suspicion of the medical establishment, including our government. It doesn't have to be the end of the story, but we cannot ignore the story.
You know, and I'm really glad that you bring up what's happening in our own backyard and so for example, right now, there's a COVID vaccine, and Pfizer is one of the leading COVID vaccine developers. And you've written about how Pfizer, as recently as 1997, was responsible for conducting medical experiments on Nigerian children, in which 11 children died and dozens more were paralyzed. And we can see how these sort of practices breed mistrust, and how that mistrust has long-term harmful effects. You discussed the Tuskegee experiment, and we've seen how there was one study that showed that revelations about the Tuskegee experiment ended up resulting in a 1.5-year less life expectancy of older Black men. And so I would love if you could talk about the relationship between pharmaceutical companies and the Black community, and sort of how badly damaged is the trust there, and what do pharmaceutical companies need to do to gain that trust back?
It's complicated by a number of issues. For example, there's something within the law called the learned intermediary, which means that even if a pharmaceutical company does something that might be, let's say, unethical towards the public, or in some other way is engaged in a practice that we could say is not tenable, there's no specific law that's against it per se, in the end, they're not the party that might be legally liable, because within law, we have something called the learned intermediary, which means that it really falls upon your doctor. And in many ways, that's unfair, right? And that is to say, if there is something harmful that happens that a doctor has no clue about it, the doctor, as the learned intermediary, is the person that the law turns to. But in terms of your broader question with regard to pharmaceutical companies, right now it's been a challenging time more broadly, even beyond race, right? Even as we look at the opioid crisis in the United States and the fallout from that, which has resulted in numerous lawsuits across the country brought by states' attorneys general and others seeking to recover damages for the broad scale use of opioids. Now, mostly that's been framed by white Americans who suffered in that regard. And we've really not given the proper attention that we need to how African Americans and other communities of color have been affected. And you're right, with Pfizer, the study that it conducted in Nigeria was horrific. There was a meningitis outbreak in Nigeria. Doctors Without Borders showed up to provide the care that was needed and to provide that for free for the families and children who suffered from this outbreak. But so did Pfizer show up as well, as court documents show. And Pfizer provided a treatment that was actually banned for the use of children in the United States. That was already very clear, but this was the drug that was actually used, which they provided, and there were a number of injuries and deaths that resulted. The individuals who were harmed and their families attempted to sue, and it was a bit challenging for them because what happened took place in Nigeria, not in the United States. It was offshore, so there was a jurisdictional problem there, a legal entanglement. But certainly, episodes such as that cause concern and alarm. And when you place that in context with this history, this helps to explain why it is that Black people have some suspicion. But let's add to what you've also mentioned, which I think is critically important in understanding these times and so many others, when Black patients actually show up. So sometimes people say, well, really this is just class-based. This is a class-based issue. Poor white people suffer, and they certainly do. We've not done a good job with healthcare in the United States. We don't have universal healthcare. But what the data all shows, decades and decades of research, which is that even if we account for socioeconomic differences, the truth of it is that racism prevails, implicit and explicit bias in medical health care, meaning that even the wealthiest of Black Americans may be turned away time and time again. And there's so many stories, not just that powerful and moving story that you shared at the top of the show, but sadly, so many stories involving Black children, parents who time and time again took their children to the pediatrician or to an emergency room and were turned away during COVID only for their children to die. The same has been true for Black Americans who are in the medical profession. Stories of nurses turned away by their own hospitals several times, only to die later due to COVID. So these are realities that we need to address. And the final point is, you asked, how do we do it? I think that programs like today, providing a voice for these issues, providing some clarity about why these concerns are alive. And I think investing in working with communities make a tremendous difference. So it's not as if outsiders just coming in, but community members being able to work with medical professionals, pharmaceuticals, and so much more, because it's really important that people are treated by COVID, because there are disproportionate deaths in Black and Latinx and Indigenous communities.
I'm glad you bring that up about how there are so many families who are affected by sort of implicit bias. And there's one survey that actually showed that 1 in 5 Black adults said that they say that they were treated unfairly because of their race in the past year when trying to get healthcare for themselves or a family member. So I would love if you could sort of expand on racial bias in the medical field and what the profession needs to do about it.
Well, so one point of reference happens to be how we train, how people come to understand when they're medical students, nursing students, in relation to the patients that they will serve. There's a very telling survey study out of the University of Virginia from a few years ago. This is recent. This is not 1950s, 60s, 70s, 80s, 90s, just a few years ago, where medical students were surveyed about questions with relation to race. First year, second year, third year, fourth year medical students. And they were asked, well, do Black people have different skin density? Do the blood of Black people coagulate differently? Do Black people feel pain differently from white people? Now, in all of these, you're like, no, there's no genetic difference. Right, it's like common sense. The stunning thing is it wasn't common sense. Not at all. There were students that reported that, yes, Black people have thicker skin than white people. Black people feel pain differently than white people. Black people's blood coagulates differently than white people, right? These kind of arcane notions that are rooted in the cultures of racist history in our country then means trying to teach them out of people who are coming into medical school with these kinds of perceptions. So at every level in our society, we have to address these issues. We could speak specifically to medical schools. Medical schools have a serious pipeline problem, right? In that there are not enough people of color in the pipeline, either as medical professors, medical school professors, or students. The same is true in nursing, where we have to do better. And we actually have to do teaching. Teaching really does matter. In recent months, there's been an attack on teaching about the history of race and racism in the United States. But I think it's part of why we've not been able to progress as much as we should have, as much as our nation deserves, on serious questions of racial injustice. One of the significant reasons why we have not progressed where we should be is because we've denied these histories. We've supplanted them. We've cemented over them. We've pretended that they simply don't exist. We've held up monuments to people who have tortured Black bodies, and we've said that these are the people who should be hailed in our society. And we pay no attention, very little attention, to those who have tried to forge new ways of understanding and protecting what should be at the center of our democracy, which is equality. It is liberty, which are notions that we're not different from each other. Everyone deserves the same equal opportunity, and that includes in healthcare. There's nothing more painful than to recount the kind of stories that you did, and I'll add one to it. During this summer, our nation came to a standstill after the death, a tragic lynching death of George Floyd, which we saw in Minneapolis, captured by video. It was as if receiving a video postcard in the way that the paper ones did in the 1920s and 30s of a lynching. And this was only after Breonna Taylor's death. But what's very interesting is that it really cemented this notion about Black people not being able to breathe. Well, to the point of this conversation, I would lift up the name of Barbara Dawson, a Black grandmother who called an ambulance because she couldn't breathe. And she went to a local nearby Florida hospital complaining that she could not breathe. At the hospital, at a certain point, they wanted her to leave. She had no criminal record. She was a person who said, I can't breathe. And from there, we get the report from the police officer and his audio camera. And you hear Mrs. Dawson screaming out in pain, calling for God, saying, but I can't breathe, but I can't breathe. And you hear the officer saying, you're just pretending. You're just playing. We're going to take this oxygen mask from you. He calls for medical staff and they help him to disconnect her oxygen port from the wall. In fact, they show him that you can get rid of her oxygen by moving it away from the wall. These are the medical staff and professionals. They handcuffed this Black grandmother who went to the hospital because she couldn't breathe. And now they're moving her out of the hospital, claiming that she's trespassing because she's a patient in need of care. This woman dies, steps outside of the hospital as they force her arms behind her back, handcuff her, and push her out to the squad car. She collapses right in front of the squad car and dies. Cause of death? Blood clot in her lungs. It's horrible audio. If you listen to the audio, it will make you weep. Listening shortly before Christmas, a couple years ago, this Black woman, Mrs. Barbara Dawson, crying out for God, saying, but I can't breathe and I can't breathe. And a hospital calling the police on her being arrested and then dying right outside of the hospital, slumped next to a police car. That's the state of race and medicine in the United States. It doesn't have to be, but sadly, that is part of the picture, and that is what we must address.
You know, when we hear these stories, it's no wonder that there are so many people in America who are Black who say, I'm not going to trust a doctor who's not Black. I think that same survey that you mentioned had that same fact, which is that many Black Americans will only trust Black doctors. And we can see why that is. And it sort of brings me to some of the challenges that will come up in the months ahead. You know, so many people need to be vaccinated in the next coming year in order for things to return to normal. But that's going to be really difficult when only 5% of the medical profession is Black. And so I would love if we could just sort of wrap up by talking about how the medical community can address these sorts of challenges, both in terms of getting the vaccine to be distributed and also sort of the broader challenges.
Well, one thing is that we have to make sure that there's equitable distribution of the vaccine. So that's really important because there is also a little bit of hysteria behind vaccination that's not something that's generated by Black communities at all, right? So there are the anti-vaxxers who happen to not be Black, right? So Black parents do vaccinate their kids. And when Black parents have not vaccinated their kids, it's not for lack of wanting to do so, but it may be because they're homeless, they've moved from one place to the other, and they don't have adequate nearby local medical care. And so to do this effectively, we need herd immunity, which means that we have to make sure that we get as many Americans as possible vaccinated in order to protect us all. And I think in doing that, this is a great opportunity for alliances to be built in healthy, transparent ways. And that is collaborations with Black doctors, with Black nurses, and other health professionals to do that. to have the kind of messaging that engages the community, the kind of messaging that engages the community where it happens to be. And so if that means engaging Black churches, then do so. If that means engaging with Black businesses that are local, then do so. Black medical professionals, like every other space of life, then do that. And to be honest, we need to do that in more broader scale ways across the United States, because not only do we have a challenge with this explicit, very clear history of wrongs that have happened to Black people in medicine. But on the other end, we have people who've denied that COVID-19 is a reality. And those are white people in the United States that we also need to make sure get vaccinated as well in order to protect them and their communities and their children. So we need to be dynamic, we need to be nimble, and we need to think outside of the box as we address this. And right now, those in the Biden-Harris administration, those who want to work on these issues should be broadly getting in touch with as many Black researchers and medical doctors and nurses and practitioners as they possibly can to join in an effort to make sure that people feel a sense of safety and feel a sense of trust and go forward with getting vaccinated.
Professor, thank you so much for all of your work on this issue and for joining us today. It's been an absolute pleasure.
It's been my pleasure. Thank you so much for hosting.
Thank you. So there you have it. Despite hundreds of millions of incoming vaccine doses for COVID, there is substantial concern within the Black community that Black communities won't receive adequate medical treatment. And so the bridge building, as Professor Goodwin just said, needs to happen right now, and it needs to center leaders in Black communities. And if that happens, and if that trust can be rebuilt, it could go a long way of ensuring that families like the Fowler family, like Keith Gambrell's family, are not forced to spend the holidays dealing with the deaths of their loved ones. So that is all the time we have for today. Thank you so much for joining us. You can follow us on Twitter and Facebook, on The Appeal News on Facebook and The Appeal on Twitter.